because otherwise there can sometimes be some feedback with the sound. Yeah, but I think we'll start. So today we're going to be talking about Alzheimer's disease and just about what you know about it already. We're going to look at it from a more scientific perspective, but then we're also going to introduce some of the ethical issues surrounding it. And yeah, so first of all, Siddhant, do you want to?
Yeah, so can everyone just in the chat put what they think of Alzheimer's disease? It could be anything. So it could be symptoms of Alzheimer's disease, it could be what causes it, whatever you think that you know. Anything you guys know, could you please put it in the chat? And we just want to see where everyone is with this disease. Anything you guys might know at all about Alzheimer's disease, a type of dementia. Okay, that is correct. I believe that's correct, right, Shabazz? I think it's correct. And anyone else? Neurodegenerative disease, yes. More common amongst the elderly. Yeah, that's true. Okay, does anyone know like symptoms of it maybe? Any?
Your lovely shawl.
Yeah, could I remind everyone to keep their microphones muted, please, unless you're speaking about this topic.
Yeah. So someone said can't be cured, memory loss. Yes, that's really true. Yeah. So memory loss is a very common symptom associated with Alzheimer's, and yes, it can't be cured once it's started. Cool. So Alzheimer's disease is an irreversible brain disorder that damages memory, the ability to make decisions, and thinking skills. And like someone said, yes, it is a type of dementia, and it's the most common type of dementia, in fact. And risk factors are including age, family history, untreated depression, lifestyle factors. So for example, when you get older, the chances get increased. Your family history obviously counts a lot. If someone else in your family has had it, you're more prone to it. And like it says, untreated depression and different types of lifestyle factors.
Right, yeah, so we're going to now talk a bit about the science behind Alzheimer's and how it actually affects the brain itself. So the first major factor is tau, and this is a protein which will accumulate inside neurons. So for those of you who don't know, neurons are the main type of cell inside your brains, which is responsible for sending signals and therefore, coordinating what your body does. And so tau will accumulate inside the neurons themselves, forming these tangles, as you can see in the picture here. And this will eventually spread throughout the brain via neurons. And we'll see how that can affect it in a minute. And the second major factor is beta amyloid, which is another protein, and this will misfold and clump into plaques, which will build up between the synapses. You can see here in this, this brown sort of build up, that's beta amyloid. And this can actually occur years or even decades before symptoms of Alzheimer's start to show. And this is quite important, and we'll discuss this a little later. And so, as we mentioned before, there are various lifestyle factors which can increase your risk of developing dementia or Alzheimer's disease. And one of those is cardiovascular disease. And that's due to blood supply. So if you are fairly unhealthy, if you don't eat healthily, if you don't exercise enough, then that can lead to buildup of cholesterol in your blood vessels, especially in the coronary arteries. And this can mean that there is a restriction of blood flowing across your body, and specifically to the brain. And this can lead to less glucose, for example, being present and reaching your nerve cells, and not providing, meaning that not enough energy is released. And therefore neurons may start to die and not function properly. And another major type of factor that can contribute to dementia is microglia. And these are immune cells which are present in the brain, and they're responsible for basically clearing out malfunctioning brain cells, including amyloid, which we talked about before, these plaques. And however, they can also be activated by amyloid and release inflammatory cytokines, which can damage the neurons. So basically, all these different things that happen in the brain contribute to Alzheimer's disease by damaging neurons themselves. And this damage to neurons is what will cause Alzheimer's disease to develop, and what will cause the symptoms to show eventually. So yeah, we're going to move on. Siddhant, do you want to?
Yeah, cool. So does anyone know what a brain with Alzheimer's looks like? And this is one of those things that you can't really know if you haven't ever seen it before, but it is quite a significant change. So does anyone know any specifics about what the brain looks like?
So please put your answers in the chat.
Yeah.
And if anyone, yeah. Okay, so we've already got someone said, isn't it shrunken? Right.
Okay, any other guesses? Before we reveal if that's correct or not. Sorry, Shavas. Any other guesses about maybe color change, maybe, water levels and parts are gone? Okay. Reduced size of the cerebrum. Okay. Maybe it's a cerebrum, maybe it's a different part. Are the foldings of the brain the same? Is it a darker color? Yes, someone said darker color. Maybe it's a darker color. Okay, Shivas, if you want to go to the next slide. Reduced cortex. Yeah, exactly. Well done. So that's what a brain with Alzheimer's looks like. And you can see that it is shrunken. So really well done. It is a darker color. And does anyone know what the outer part of the brain is called? The outer part, the one that we most commonly see.
Sorry. Yeah, I think some people have mentioned it. It's cerebral cortex or cerebrum. But yeah, it's just the outer layer you can see here. And that's the part that's been affected. Just move on.
Cool. So as neurons die, neurotransmitters can no longer travel across synapses. So remember, when you've got the way that your body sends signals is you've got neurons and you've got these junction between them, and neurotransmitter diffuses across these junctions and sets up an electrical impulse in the postsynaptic neuron. And so that's called a synapse. And that's called a neurotransmitter, and that's basically the electrical impulses that are sent to your CNS. And so messages cannot travel through to the brain, which is the head of, like, basically the thing that controls your body. The brain shrinks as tissues die, and the first areas to be affected are the hippocampus, which most people know to be involved in memory, and the cerebral cortex, which is like the spongy bit on the outside. And this is involved in basically everything else. It's involved in speech, language, and decision making. And you can see in the diagram that Shivas has put there that in the normal brain on the left side, the hippocampus is slightly bigger, and you can see it's much more fuller, and it's the cerebral cortex folds are a lot more tighter. However, in the severe Alzheimer's affected brain on the right side, you can see that there's an extreme shrinkage. You can see the gap it going down the middle between the length of the cerebral cortex and the cerebral cortex with Alzheimer's. And the ventricles are huge, so that means that the gaps are greater, but then the mass of the brain, the spongy part, is less. And as you can see, the hippocampus is tiny, and again, the gaps are huge, and that's what makes it so tiny.
Yeah, so we can see, how much there is an actual physical change in the brain as well. And that obviously these parts that are affected, the hippocampus and cerebral cortex, that will, lead to the symptoms of dementia. So we have memory loss, worse speech and language, coordination, decision-making, memory, critical thinking. All of this stuff is affected due to these parts of the brain which are damaged. So yeah, now we're going to move on and talk about some case studies and some examples of people with dementia. Yes, someone's just asked a question in the chat. Due to the shrinking of the brain, would this lead to an increase in the risk of severe head injury as the brain is able to move around more within the skull? The brain is not as well fit in the skull. Yes, I believe it can actually, and I read about this before. The brain, because it is smaller as well, it is more prone to being sort of knocked around, and that can obviously lead to even more damage. So yeah. So the first example we're going to talk about, I'll just read it out loud and then we'll discuss it. So Eliza, aged 80, has recently been diagnosed with severe Alzheimer's disease. Her cognitive ability and speech has been very badly affected. She lives in a care home and requires full-time assistance for basic daily tasks. Eliza recently came into your hospital after falling unconscious and wheezing. You, the doctor, realized she needs immediate access to a life support machine. However, you can probably tell where this is going. John, a 14-year-old boy, has experienced lung damage after being hit by a car. He also requires a life support machine, but there's only one left in the hospital. Neither patient can be transferred to another hospital in time to save them. The boy's parents beg you to keep him alive. They tell you that John's older brother died last year in a skiing accident, and they cannot bear to lose another child, right? So this example is not particularly realistic in the sense that it's very unlikely that a hospital would, not have, enough life support machines, or it wouldn't be possible to treat them in some other way. But for the sake of argument, we're going to assume that, this is what's happening. And what we're going to discuss is, firstly, what would you do if you were the doctor in this situation and you had to pick a patient? And the main idea of this question is whether patients who do have Alzheimer's deserve to be treated more than patients without, or less than patients without, or does that not matter? So this is what we want to discuss here. Should all patients be treated equally? Obviously, the NHS tries to, it says in the NHS, their code, they want to try and give all patients access to the best quality healthcare, regardless of, their background, etc. So do you think that should be upheld here, or do you think perhaps patients with dementia should not receive the same care? So yeah, we'd like to see your thoughts on that. So please do put what you think in the chat. Firstly, who you think should get the life support machine, and perhaps if you can link your answer to any of the 4 pillars of medical ethics as well: beneficence, non-maleficence, justice, and autonomy. So yeah, we'll give you a minute to do that. Okay, someone has asked about the recordings. We'll inform you about that in due course. We have a slightly different plan for that, but we will keep you updated. Right, Sinan, do you want to, my computer's slightly frozen, so do you want to, hang on one second, I'll just read this one out and then I'll have to change my computer quickly.
Yeah.
But yeah, so someone said, in this case, I don't think we should discriminate against pre-existing health conditions like Alzheimer's. We should focus on clinical need, which patients need it more urgently and may possibly die soon. We can also discriminate based on futility and QALYs, how likely the life support machine is going to improve the patient's life. Okay, so that's very interesting. And I think what you're trying to say here is that we should try and treat it on a kind of case-by-case basis, in the sense that we should try and, we shouldn't just say they have dementia, therefore they shouldn't be treated. But you're saying that we should try and look at them as a whole and whether they should, how urgent their need of it is. Yeah, Sudan, do you want to add on to that? Sorry, I'll just have to join from my laptop.
Yeah, so someone said, I wanted to ask which pillar would QALS fall under? I'm sorry if it does not answer the question exactly, but it plays a big role in the future of the patient. So could you clarify what you mean by QALS? QALYS, sorry. Quality added life years. Oh, right. I don't know. Maybe it's autonomy, because obviously if that person believes that when they wake up, unless the person is incompetent of making decisions, then I guess if when they recover, they would be quality adjusted life years. Yeah, exactly. So I mean, I honestly don't know. It depends on the person. Some people might not prefer to prolong suffering just for the sake of living. Some people might believe that it's more likely to go to someone who's possibly more likely to live. For example, the 14-year-old boy, and it depends. I think it's based on who it would benefit most. For example, the elderly person aged 80 doesn't really have many years left, whereas the young boy, yeah, you're right, exactly. So I again, people would argue that the 14-year-old boy would potentially benefit more from such a treatment because of the fact that he has more to live, like more time, just purely based on time. And because he's younger, the recovery is more likely to be successful. So maybe that's something to consider. I would also say that someone said, yeah, I mean, lots of the same point being repeated about the fact that, it depends on who would survive and who would benefit the most. But I guess that's basically how you would determine if someone deserves it more than someone else. Obviously, that's not an easy decision to make for the medic or for the patient or for the patient's families, but it's one that you have to make. So yeah, really well done, guys. I believe Shivas. Oh, you there?
Yeah, sorry, I think I've sorted out the issue.
Cool.
Apologies about that. But yeah, no, I think people have come up with some interesting points. No one's gone for one or the other as such, but you're kind of saying it in terms of you would have to look at the patients individually and try and make a decision based on that, which I think is, what you would have to do in a real situation. But does anybody think that as a general rule, people who do have dementia they might not be entitled to healthcare as much as other people? Not entitled as such, but due to the fact that perhaps I personally don't believe this, but some might argue that people who have dementia might have less value to society, considering the fact that they might not be able to work or speak, and they might require full-time attention. Whereas in this situation, John still has his full life ahead of him, and he still has family, and therefore you could argue that his death would have a higher impact. Obviously, it's quite a difficult issue to argue. But yeah, does anyone have any thoughts on that? Right, someone said, I can understand why they think that, but we have no right to choose who lives and who dies based on their value to society. Right, this is what I personally believe. But, if you were in this situation then, and you were trying to argue it from a beneficence point of view, perhaps, if you're trying to do what's not only best for the patient, but best for the most people, you could argue that, saving John might be better. Yeah, someone else has said, I mean, it's not necessarily down to value to society, it's about what their quality of life would be like, because living with dementia causes a low quality of life. So is it really fair on the patient? Right, yeah, and that's another good point. If we're looking at it from, Eliza's point of view, we know that her Alzheimer's is very severe. She can't speak properly, she requires full-time assistance, and therefore you could argue that she's already experiencing such a low quality of life that it might not be in her best interest to keep her alive. And that's where stuff like, do not attempt resuscitation, that kind of thing comes in. But yeah, it's an interesting point. And then that brings us, to the last question we've got here. Should all patients be treated equally? So I wondered, generally, not just talking about Alzheimer's, but does everyone think that patients should, be entitled to the same healthcare regardless of their pre-existing conditions? Should all patients be treated fairly and given access to, life support machines, for example? Yeah, so does anyone have any just general thoughts on that? I know lots of you have already said it depends on the person themselves, and you have to look at all the details together to come up with a decision. Okay, well, I've seen a comment from before about how we shouldn't discriminate against pre-existing health conditions like Alzheimer's. We should focus on clinical need, which patient needs it more urgently. Yeah, so someone else has now said, initially they should be treated equally, but when having to choose, you should delve into the details of each patient. And then someone else has said, yes, I believe all patients should have the opportunities available in the system. When it comes down to could, that brings up difficult situations. And then we've got theoretically, of course, but in reality, it isn't always that straightforward. However, as you said, the NHS strives to protect the best healthcare for all. Okay, yeah, so we've got a range of ideas here, but I think the general theme that's coming through is that patients should be given, in theory, they can access all types of treatments and they shouldn't be discriminated against. However, in reality, the doctor would have to take into account different decisions and try and, act accordingly. So yeah, I think with that, we'll move on. It's not, there's no right answer here, but it's interesting to discuss and see what you would do in this situation. Because sometimes, even though according to the 4 pillars of medical ethics, you're led to a decision, but in reality, making that decision might not always be ethical. So yeah, we'll move on now. Siddhant, do you want to take this one?
Cool. So we're going to talk about the rights of a patient with Alzheimer's. So Gavin, age 79, has recently been diagnosed with Alzheimer's disease. He has intermittent memory loss and often struggles to remember events and details from the past. Gavin has come into your hospital after struggling from a heart attack. You are able to treat him with drugs, but he remains unconscious and in an unstable condition. Unfortunately, you do not believe he will survive for another 24 hours. In 1999, Gavin made the decision that he did not want to donate his organs. However, he now tells you that he would like to change his mind. Despite this, a recent mental examination concluded that Gavin's dementia made him incompetent under the Mental Capacity Act to make important medical decisions. Therefore, you are forced to tell him that you are not able to follow through with his wishes. Should people, therefore, with Alzheimer's be allowed to make important medical decisions? Right, so obviously, as we know about the law, right, the law says that if you're not competent under the Mental Capacity Act, then it depends on the consent. So if someone else has the lasting power of attorney, maybe the doctor, because the doctor gets in a say in it, if it's something that's, definitely going to hurt the patient, then in some cases they get to override everyone's else consent. Or maybe there's a anticipated decision, like we said, the legally binding decision, which the person would have made in his past, knowing that he'd be incompetent in the future. But ethically, do you guys think that people with Alzheimer's should be allowed to make important medical decisions? So if you guys should, yes, I believe all the patients should have the opportunities available in the system. When it comes down to could, that brings up difficult situations. Yeah, that's right, exactly. Because everyone should be allowed. However, again, the practicalities of this do not meet the expectations, because you have to realize that if they are incompetent mentally or have been deemed incompetent, then that means that they might make decisions which are potentially harmful, or they don't fully understand the extent of the entire decision that they're making. So it's very important to realize that.
I think sorry to interrupt. I think that was for the previous case study. Not this one.
Okay, it worked.
Don't worry. Yeah, I guess. Yeah.
Theoretically, of course, but in reality, it isn't always that straightforward. However, as you said, the NHS strives to provide the best healthcare for all. Okay. So, is this also for the previous one?
Possibly, yeah. I think it was.
Guys, I'll give you 2 minutes to put any suggestions you want into the chat about what you think about this. Should people with Alzheimer's be allowed to make important medical decisions? Anyone? 2 minutes. You can read through it.
And think about the 4 pillars as well, in terms of, in this case, if Gavin was allowed to donate his organs, say, he wasn't deemed incompetent due to his dementia, then that could have potentially, saved a life. So is it really, ethical to allow, or is it really the best thing to do to give patients who have dementia limited rights in terms of the decisions they are allowed to make? Okay, we've got a few comments coming in. Okay, so someone said a discussion with the family should take place, as the family are likely to understand the patient's wishes and help with decisions. Okay, that's an interesting point. Although, yeah, no, That's true, and that is the case nowadays in terms of what happens. The family is, you know, when a patient is unable to make a decision for themselves, the family will be, you know, asked to act in the interest of the patient, or act or explain what the patient would have wanted if they were able to make that decision. So somebody else has said, only if they are deemed incompetent should they be limited to make that decision. Yeah, but, you know, that also brings us to the point about, can we override decisions based on what patients have made in the past? Because obviously this links to autonomy as well. We know that Gavin now wants to make a certain decision, but you can't allow him that because of incompetence. So, you know, it's tricky, because in this case, we're actually going against quite a few pillars of medical ethics. We are firstly not following a patient's autonomy in terms of the decision they're making. We're not respecting that, although you could argue that it's not his decision, or perhaps it's not a decision that he has made knowing all the facts surrounding it. That's what incompetence is about. But we are not following his decision, and we're not helping other patients. We're not following beneficence and non-maleficence as well. And also perhaps justice, is in the sense that you could argue all patients are entitled to organs, and therefore, you know, you should try and, you know, donating those organs would be the best option. Yeah. So hang on, I'm just trying to find the comment we're at. No, when deemed incompetent, they may not actually realize the extent of their decisions. Yes, that's what we're talking about. It might not, you could argue that it doesn't go against autonomy because they don't understand the decision they're making, and that's why they've been deemed incompetent. You know, for example, if this was the other way around, he wanted to donate organs in the past, but now he didn't. You could argue that now he didn't really understand, or he was perhaps scared, and he didn't really, because of his dementia, it had reduced his ability to, you know, understand the facts fully. So yeah. Sorry, I've lost the comment. I think to honour patient autonomy, you'd have to take into account the decision the patient made when they had capacity. That's true, but, you know, because now he has asked to make a decision now, so you could argue that we are going against his autonomy. So does autonomy run out when you stop being competent? Does your opinion no longer matter when you're incompetent? It's a tricky decision. Sidan, do you want to go through a few of the next comments of that?
Yeah. Have you gone through this one? I think in this case there might be a slight exception. The last one.
We're on the one above that, I think.
Okay. Sorry, it's not loading. Oh, okay. Patients with dementia are often subjected to change in their mind, so it is a tough decision to take in the best interest of that patient. So that is slightly lost at this point. Don't really understand the point. I think what you might be trying to say is the fact that it's a tough decision because their mind is constantly undergoing change. They might have a different opinion all the time, and so because of this, they might, you know, have different approaches to their best interests, constantly changing. But yeah, that is a good point, that because it's such a rapid change and it's a degenerative disease and neurodegenerative disease, it's quite important to realize that people who might seem completely in possession of their faculties may not be able to make great decisions, especially ones that need careful thinking through with their great interests at heart at the drop of a hat. So that's a very good point, and we have to take the constantly changing nature of this disease into account. I think in this case, there might be a slight exception, as people with Alzheimer's disease can have moments of clarity, and the decision was made in 1999. So their views might have changed in 21 years. And from a utilitarian viewpoint, this would be more helpful and therefore is more ethical. However, the slight issue is that what constitutes as a moment of clarity, because family members sometimes take advantage of the fact that they have Alzheimer's, example, changing a will. Yeah, that's a really good question. What does count as a moment of clarity? Because someone might be deemed competent just because of their age or because they lack any other mental condition, but then how does anyone know that they're not being influenced by someone else, or that they're not under a huge amount of stress which might be impacting the decision, or some other externality which might be causing some sort of effect on the decision making process? So it's very, very difficult to say, really. And I think that's a really good point, that in the last 21 years the decision could definitely have changed, and even though he might not be deemed competent, it's quite possible that in reality he's more competent than ever, because maybe he's had more experience, or maybe in the last 21 years he's thought over it. So that's a really good point. And yeah, it just proves the multifaceted nature of decision making, especially in cases where the mental capacity of a person is compromised by a disease such as Alzheimer's. Shivas, do you have anything to add?
Yeah, no, I think that's a really good point, because the thing is now with Alzheimer's, because it is a mental condition, and obviously the symptoms aren't, they can come and go. Sometimes there are memory lapses, sometimes there are problems with cognitive and thinking skills, but at other times there aren't. And we don't know if this patient, when he's making this decision, when he says he wants to donate his organs, we don't know whether that is, influenced by his dementia or not. And you're right, 22 years now, he has had time to rethink this decision, and perhaps he did come to the conclusion that he wanted to change his mind, and he wanted to donate his organs, but because he had dementia now, that decision is overruled. So yeah, that's the problem here. And now to answer this, oh yeah, someone has also said, it also says he was recently diagnosed with it, so perhaps he's not at the worst stage of Alzheimer's. That's true. As well, but the thing is, because with Alzheimer's, it's very tricky to know when a patient is experiencing problems, or when they are not. So yeah, and someone also said, I think it's also important to somehow find out why in 1999 he made the decision that he did not want to donate his organs. If it was religious or something like that, it's more likely he wouldn't change his mind now. Yeah, I think that's really important. And in a real life situation, of course, that's what a doctor would try and do. Perhaps we could speak to the family. And yeah, if he is religious, definitely some religions will, people make decisions not to donate organs because of religious beliefs. And therefore, if we know he is quite a devout religious person, then that decision may not have in reality changed, and we can perhaps deduce that what he's saying now is influenced by his dementia, but it's not really reflective of what he truly wants. Yeah. Does anyone have any other points they'd like to add on, or otherwise we'll move on? Yeah, so to summarize, I think really what we're saying is, many people agree that the rights of patients with Alzheimer's should be restricted in some ways, in the sense that they shouldn't be able to make important medical decisions because, they are unable to understand the full range of facts surrounding them, whereas before they may have been able to do that because of the effect on cognitive and thinking skills and memory, of course. But at the same time, that does present a threat to autonomy and the decision that the patient has made, which of course is not something which is ethical according to the 4 pillars of medical ethics. So yeah, but I think the overall consensus is that people are saying we should look into the patient more and try and understand how they really think, and try and figure out whether their decision now is reflective of how they've acted throughout their life, and the decisions they've made in the past. And that's how we should try and understand what the patient really wants. And talking to the family is a big part of that. And of course, now when patients are deemed incompetent, their family is usually the first port of call for doctors when trying to make important decisions. Yeah, so we're going to move on now. Siddhant, do you have anything to add? No? Okay. Okay, so we'll move on, and we're going to talk a bit more about memory loss in general. This isn't necessarily related to dementia. This book, The Man Who Mistook His Wife for a Hat, is very popular. I don't know how many of you have read it, but if you haven't, I would definitely recommend it. Basically, it's about the doctor who, recounts his stories of patients with rare and often incurable neurological disorders, including, severe memory loss. And it's a really, really good book. So I'd really recommend it if you haven't read it already, by Oliver Sacks. So yeah, and basically one of the patients that he encounters is a man named Donald, who murders his girlfriend whilst under the influence of the drug PCP. However, Donald claimed during the trial to have no recollection of the incident at all. Despite this, he was arrested and sent to a criminal psychiatric hospital. Years later, he sustained a head injury while cycling, which left him in a coma for 2 weeks. When he awoke, he could remember the murder in almost photographic detail, causing Donald to become racked with guilt and eventually causing him to attempt to kill himself. So put yourself in Donald's position. If you were going to be arrested for a crime you had no memory of committing, that would be quite emotionally stressful, because you are obviously of the belief that you're innocent, even though you might not actually be innocent. And this is just one of the problems that memory loss can present. And so this isn't necessarily to do with, dementia, but firstly, do you think criminals who have no recollection of their crime, do you think they should be punished? Because obviously the criminal might believe that they are innocent. And then also, what problems could this create, not only in the judicial system, but also in a medical setting with patients who can't remember things? What problem could memory loss cause in a medical setting? So, if anyone has any ideas on that, please do put them in the chat. I will be happy to discuss them. Okay, yeah, so someone's put people who forget their allergies. That's a really, really important one, because, and it is quite common actually among people with dementia. That's why it's so important for doctors to, get their full medical records, because the patients often are unable to remember themselves, and they're unable to remember themselves, and sometimes they can make mistakes and they can confuse different allergies or different things they're, not meant to have, or things they've taken already. And obviously, if patients have to take a pill every day or something, it's very important that they receive care for that, because, to avoid mistakes. So yeah, that's just one of the problems. And obviously, we saw in the last case study, decisions made in the past. That's another problem, because patients may not remember them. So someone said, I think in the medical setting, having dementia could be quite stressful for the patient, as they may feel they're in a strange, abnormal environment, which could result in anger, anxiety, and maybe violence. Yeah, and for those of you who've read this book, you'll know that many patients who experience memory loss, who are mentioned in the book, do, often feel very strange, and they don't really understand what's going on. And therefore, again, it's very important for doctors to reassure patients and keep reminding them about, where they are and what kind of treatment they're receiving. But yeah, it's very tricky. Someone said, I think the entire life history of the patient should be assessed before turning to the justice system. Are not the criminals who plead are turned to mental institutions? Yeah. So yeah, and it's very important, again, to analyze all the facts here. And if there is hard evidence for a crime, then, that would have to overrule the opinions of the person who is going to be sent to prison. Obviously, criminals who have no recollection of their crime but did commit it, they've still committed a crime nonetheless, and therefore, in my opinion, they should be arrested, but they should also be reassured, in the sense they should be presented with evidence and explain to them what has happened. Someone has said they shouldn't be punished. It's more important to get them medical psychiatric help. Yeah, that's interesting, but you've got to remember that this person, most likely, if they did commit the crime whilst competent, then they've committed a crime nonetheless, regardless of whether they're mentally ill or not. And therefore, you could argue, some people might argue that having a mental condition or being under the influence of certain drugs might be looked at as an excuse to get away with crimes. Yeah, exactly. Someone has said, what happens if they take advantage of it and fake having no recollection? Yeah, that's a big problem which could arise out of this. Someone said they could have no recollection due to trauma because of the crime. However, that kind of does not change the fact that they committed it and may have even committed it while fully aware. So that's what we were talking about before. As a result, it would be hard to absolve them because of that. Instead of straight punishment, it should be some sort of help. Yeah, so someone's put, an issue is the fact that people may abuse this and use it as a loophole. Yeah, so that this is what we were talking about. This is what we talked about before, in the sense that some people might take advantage of the fact that mental disorders could be used as an excuse for getting away with these crimes. That's not to say that people who have mental disorders should not be helped, because obviously I'm sure everyone would agree that people who are suffering from these should be treated and should be helped. But at the same time, people could take advantage of that if that would result in a lesser punishment. Yeah, so I think we'll move on now. That was a very interesting discussion. Yeah, so someone said, did they address the fact that he took the PCP drug? Yes, so I think that's why he was sent to a psychiatric hospital rather than jail. But they still, again, if this was applied to a situation where there was no, evidence for a criminal taking a drug, then it might be believed that the criminal is making it up. So these are just some of the issues that can arise. So yeah, we're going to move on. Siddhant, do you want to take this one?
Yeah. So, can we cure Alzheimer's disease? So, I don't know how many of you have read this, but this was a BBC News article which talked about the effect of cold water and the fact that it could potentially be dementia cure, or could hold a secret to curing dementia, because a recent study showed by Cambridge University suggested that swimming in cold water could protect the brain from dementia. Blood tests from a group of cold water swimmers, right, people who swam in cold water, showed elevated levels of a protein called RBM3. This protein plays a role in repairing damaged neurons. It is found in hibernating animals, mammals. Sorry. So when mammals slept, obviously, that it helped them it helped them repair damaged neurons, because when you're sleeping, you're not exactly active, so you're not repairing your neurons via nutrition or anything like that. And the fact of the matter is that the RBM3, they had a high concentration of it, which helped them with the neurons. And seeing that neurons are also damaged in dementia, this could be helpful. The scientists artificially boosted RBM3 levels in mice and showed that Alzheimer's and prion disease could be prevented. So they've seen that this protein, which is found in hibernating mammals, which they saw, might be helpful for them to repair neurons in hibernating mammals. And so what they did was they took the RBM3 and they plugged into that, they boosted the levels in mice, and then the study showed that it could actually prevent Alzheimer's and prion disease in these mice. And so this makes us think, possibly in humans, this could have the same effect. So what problems could a drug for Alzheimer's lead to? Does anyone have any clues? Like any ideas about what problems could a drug for Alzheimer's lead to? It's a bit of a weird question, this one, because people would think, if it's a cure, then surely there wouldn't be any problems with it, because obviously cures are meant to be good. But think about maybe the practicalities, think about what's happening with current drugs, think about, the availability, who would get the drug, etc. Any ideas?
You've got to remember that this isn't, this drug, if it were to be made into a drug, this wouldn't be a cure, in the sense that it wouldn't be able to cure Alzheimer's once it developed. It would be used to prevent Alzheimer's from, so as someone said, it's preventable. Yeah. It's not something which could, when Alzheimer's does develop, there is no way of curing it. There's no way of stopping it or reversing it. But in terms of preventing it, this is an option that could be explored further. So, if it were developed, what could some of the problems caused by that be?
Side effects. Yeah, that's possible. Toxicity is always something that could be problematic. And actually, this is a good point. Normal people, by normal, I assume you mean people who aren't, who don't have Alzheimer's or are not prone to it, could take them as a preventative measure, which could bring other health conditions maybe. That's a good point, because we don't know what the effects of RBM3 are if you don't have this problem. And so if people are taking them, that could be problematic. It's a good thing unless the side effects are unwanted by the patient. Yeah, that's a good point, because if the side effects do include something which is also, because this is affecting your neurons, so this could have another neurological problem. Again, that's a really good point. And someone said overdosing. I guess that's a problem with any drug, though. Any drug with any effect on a human which is not natural is prone to being overdosed by the patient or the person who's ingesting the drugs. And there's only so much you can do about that, but that is a major concern. And if it's over the counter, sometimes people have phases with memory loss, which are not persistent. People may take it when they don't really have dementia, but think they do. That's a good point, because if they start taking it and, maybe the memory loss is also caused by the drug. We don't know. I mean, this drug doesn't exist yet. So it's very, very important that, we if the drug was made, then it would have to be checked severely, rigorously, and repeatedly. Existing sufferers may feel left out from the treatment and feel even more helpless. Yes, that's true. It is true that they would feel helpless, that, the drug wasn't there when they could have taken it. However, I guess that's the problem with any sort of new medicine, is that it develops, but then there will always be some people that were too late to take it or that can't take it anymore. And I'd say hopefully they'd focus on the fact that now fewer people will get this disease because of the availability of the drug, rather than dwelling on the fact that they can't take it. Existing sufferers may feel, that was the same point. Sometimes the side effects, Shivas, do you want to do this one?
Yeah, so someone said sometimes the side effects of these drugs lead to a lesser quality of life for the patient. It's not worth it. There's no reason not to help the patient, help the people who can be helped from it. Yeah, that's an interesting point. And when drugs are developed, then we have to take these into account. They take these factors into account. One of the points which links to the point before about existing sufferers may feel left out is that, if this drug were to be created, obviously it could be very expensive to produce. And if it were not, provided by the NHS or something, then it could potentially lead to a class gap in terms of, wealthier people being able to afford it, and people who can't afford it being, left out and having a higher risk of developing dementia. So, that's one of the potential issues. But again, it's the same with any drug, really. But overall, I'm sure we can all agree that Alzheimer's, a drug like this would be revolutionary. All right, so we've got quite a long comment here. Someone said, differentiating between Alzheimer's and other types of dementia has up to now depended on a clinical evaluation, as well as brain imaging or a spinal tap. Although there's still no cure, early diagnosis means better treatment. So it's big news that scientists have discovered a simple blood test that accurately diagnosed dementia in early stages, just in a recent article I read. And that brings us quite nicely onto the next thing that we're going to talk about, which is this blood test. I don't know if this is the same one you read about, but this is another article about blood tests which were developed in the US and Sweden, which were able to identify elevated levels of the protein p-tau217. And as we discussed right at the beginning of the presentation, tau forms tangles in the brain for years or even decades before dementia symptoms start to show. And the test could be used to diagnose it up to 20 years earlier. And as we've said, Alzheimer's cannot be stopped once it's started. Now, this is quite interesting because predicting Alzheimer's, most people would immediately say, yes, that's brilliant. We can predict Alzheimer's, that would be really helpful for patients. But is it really that helpful? If you were able to predict whether you would get Alzheimer's disease in the future, would you want to? It's an interesting question because, people who do develop Alzheimer's usually will die, quite soon to being diagnosed with it, because it's just very difficult for them to, carry on living in the normal way. And it's essentially being told when you're going to die. Would you, right now, if you were given the opportunity to find out the date of your death, would you want to know that? it's an interesting question. So yeah, lots of people are putting comments in. It may affect people's mental health and lead to suicide. Yes, because, if you're told, and obviously early onset dementia is a big problem as well, in the sense that if you found out that you were going to get dementia in your 30s or 40s, that could really affect your mental health in the sense, if you found out 20 years earlier, in your 20s perhaps, or even before then as a teenager, if you found out you were going to die in 20 years, or not die necessarily, but you were going to develop this disease, that could really damage your life, knowing that, you possibly wouldn't be able to, go through life in the same way a person without dementia would. Many people are talking about stress. Someone said it should be up to the patient whether they want to have this test or not. Okay, and obviously that's linked to autonomy. Someone said, well, if nothing can be done, finding out about it can be quite stressful and does nothing for their health, just predicts the bad future of memory loss they may have in their old age. Yeah, and again, that's what we mentioned before, Alzheimer's can't be stopped once it's started. This isn't a cure for Alzheimer's, it's just knowing whether you're going to get it or not. Someone said sometimes too much knowledge is dangerous. I really like that comment because, I agree. I think sometimes it's best not to know. Think about it. If you're going to get Alzheimer's and you know about it, that could really affect your quality of life in the sense that you wouldn't want to potentially go out and get a job. You would just kind of constantly be worrying about it and preparing for it necessarily. So you might, but it would really affect your life. And sometimes some people might argue that it's better to just leave it until you actually do get it, and then you can worry about it. But up until then, enjoy a good quality of life. Someone also said, I mean, either way, you're going to die. So yeah, that's interesting. And it's true, you are going to die either way. Surely you'd want to be prepared for it. And of course, this test would allow you to prepare for it. You would be able to tell your family, your friends, you would be able to organize carers, you would be able to take medication potentially. So, it could be very beneficial in that sense, rather than finding out one day, your memory starts to go and your thinking still start to go, and therefore it's quite a big transition and quite a shock for your friends and family when that happens, and it can be very distressing for them. If they have time to prepare for that, it might be better. Someone said, in the last question, I found writing on Wikipedia that RBM3 has possible proto-oncogenic associations to colorectal cancer. Right, I haven't heard about this, so unfortunately I don't think I can confirm that, but I'll do a bit of research on that after. Someone else has said, but obviously if that were true, if it has links to cancer, then this drug might not be, this test might not be viable. Oh no, this is RBM3, yes, so it might not be viable as a drug for treating or preventing Alzheimer's. Someone else has said, then again, if we know it beforehand, then maybe treatment can take place. For example, if you're finding out you have cancer in the future, it can be treated early stage. Yeah. So it's similar with, with cancer, perhaps you might want to find out, if you are able to find out, you could treat it early, and that could potentially be good. But at the same time, it could lead to a lot of potentially unnecessary stress, which could really negatively affect your life. Someone else has said, I personally think there's no point of this test, there's no good can come out of it. That's interesting point. I think some people would argue that giving you time to prepare for it could be a good thing, rather than just being, starting to experience this disease all of, suddenly. Right, so someone else has said, I think all screening is a medical intervention. All medical interventions have side effects, but perhaps if these potential side effects are presented to the patient, they can take a decision with all the facts. Yeah, and I think that's with any test, that applies. Right, we've got lots and lots of comments coming in. I don't know if I'll be able to read them all. Yeah, so someone has said, there is no point worrying about it earlier. Yeah, as we discussed, you could have a much better, a much more fulfilling life potentially if you don't know about it. Yeah. Someone said get your bucket list done if you know beforehand. I
I mean,
suppose, yeah.
no, I feel like if you do know that something's going to go wrong, then it's possible that you might want to start living life to the fullest. I know that, I mean, you see that in films where sometimes people know what's going to happen in the future. They hide it from everyone, but then they start, volunteering and caring about other people. And yeah, maybe it would go the other way. But yeah, personally, I would not want to know if I was going to get it or
Yeah,
not.
and also one point I thought about earlier was, what if this information was made public? What if you were, in the future someday, you are able to take tests and find out if you were going to develop Alzheimer's, and say you were applying for a job and your employer knew about that, knew that you were going to die age 30, how would that affect your employment opportunities? That's another issue. It's similar now with certain diseases, and some people are arguing that it's similar to genetic engineering and all those kind of issues as well, in the sense that if employers knew some people were genetically engineered, it's all these kind of sci-fi issues, but they could really apply in this situation. If employers knew that you were going to get this disease, they might not hire you. And someone said that would be a breach in confidentiality in general. Yes, it would, but you've got to remember that sometimes it doesn't always, confidentiality can't always be protected. And if that information were to get out, then that could have disastrous effects. Someone said this may target those that will die early and worsen inequalities within employment. That's true. And someone said, unfortunately, employers are becoming more and more intrusive into personal details, and these tests may make it more easier for them. Yeah. So, if an employer were able to find out whether you'd had this test and whether you were going to develop Alzheimer's, they could not employ you based on that, and that could lead to, even more issues. So yeah, we've had a very good discussion here. Yeah, someone else has said, could it affect relationships? Yes, that's another really good point. Some people might not want to marry you if you were going to die very soon. And it's a very sad thought, but, we don't know what effects this could have. Yeah, and someone said there should be laws passed that would protect people who have these tests. But, as we're having this discussion, we can see that more and more problems would arise from it. And therefore, in my opinion, I don't think this test should actually be developed. I don't think it should, because it would just lead to more problems than it would solutions. It would lead to too much inequality between patients who were going to get dementia and who knew that they would get dementia and those who wouldn't. Sometimes, as someone said, too much knowledge can be dangerous. And in this case, it could be dangerous not only for the person themselves, but for their whole prospects in life, their family, their friends. So yeah, in my opinion, I don't think we should predict Alzheimer's disease. Yeah, and exactly, someone said the individuals themselves may be hesitant to get into relationships knowing they're going to die. Yeah, they might not want to live a full life. They might not want to have children if they know that that child will grow up without, a mother or a father, that kind of thing. And obviously mental health is one of the main factors here that could, imagine being told at such a young age that you're going to die soon. So yeah, I think we've had a really good discussion there, and we're just going to, and I think this is kind of one of the main issues that Alzheimer's disease presents, because on the surface you would immediately say, yes, we should predict it, we should predict Alzheimer's disease, it would be so revolutionary, so helpful. But when you look at it more, you could argue that that wouldn't really be helpful at all. It would just cause more damage than good. So yeah, we're going to move on to the last sort of, couple of questions that we're not going to have a full discussion, but just a few points surrounding them. Sinan, I wonder if you want to go through these.
Yeah, so I'm just conscious of time. We have overrun a tiny bit, but Okay, so we're just going to run through these really quickly. So other issues related to Alzheimer's. Should you lie to patients with Alzheimer's? For example, is it ethical to tell them that they're getting better when they are not? Yeah, so someone said absolutely not. Never lie to a patient. You have to be honest with them, straight up and honest, because there would be a lot more distraught if they found out that they thought they were getting better, but you'd lied to them. Never sell hope. Yeah, exactly. Really good. Should dementia patients be told they have dementia? Just quickly, if you put it in the chat. Yeah, thank you. I was hoping everyone would say that. Yes, we have to be honest with patients all the time. If they have dementia, you need to let them know, because then they might want to start talking to their family about it, and they would prefer to know as quickly as possible. Interview question: people with dementia are entitled to the same quality of care as people without it. Do you agree? We would normally do the entire interview question, but let's just have a vote quickly. Let's say just put yes or no in the chat. Do you agree that people with dementia are entitled to the same quality of care as people without it? Yes, 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 yes. Okay, so across the board, everyone said yeses so far. So yeah, exactly. So because they maybe even they might even need more care just because of the fact that they have dementia, so they might need more assistance. But yeah, exactly. Justice says you have to treat everyone fairly.
Yeah.
Cool. Well done, everyone.
Yeah, so thank you everyone for that. I think we've had an interesting session today, and we've talked about some of the problems that dementia can face, that dementia can result in the sense that even though dementia patients are really, they have such a detriment to their life, they should still be treated in the same way that normal patients are. And also the fact that trying to cure dementia or trying to prevent it or trying to test for it might not actually be the way forward in tackling this disease. Yeah, dementia, it's a very interesting topic, so I would definitely recommend looking more into it, and obviously reading that book, The Man Who Mistook His Wife for a Hat. It's a really good one. But yeah, I think we will leave it there. So yeah, thank you very much for listening, everyone. And please do contact us. My screen has frozen again, so I can't move the slide, but there we go.
Oh yeah, okay, we can see it now. Yeah, so thank you everyone. Really thank you for everyone for coming, and we hope you learned something. Regarding the recordings, because I've just had a few messages on Instagram as well about that as well. We will let you know. We're currently in the process of setting something up, and we will let you know as soon as that's out. We will send you an email as well as on Instagram and everywhere that we possibly can let you know. As you can see, our Instagram is on the screen. It's at The Medical Debate. Feel free to share our events with other people as well. You can email us at themedicaldebate@gmail.com to get in touch, or to talk about anything you'd like to. So thank you very much.
Yeah, thank you very much. And yeah, please do follow us on Instagram so we can let you know about future sessions. And you can also ask us any questions on there.